Hi, I'm Gary White from Central Kentucky Television. I'm here with Dr. Trish Ciccone with Central Kentucky Optometric Associates, has offices in both Lebanon and Springfield, and we're here for this month's eye care news, and it's April, so we're going to talk about some things that come around with spring, one of them being allergies, and they usually become worse as things start to bloom and all that kind of stuff, right?
Yeah, right now the trees are blooming like crazy right now, and yeah, I can, for the last 2 weeks, folks are coming in with itchy, watery eyes and often multi-symptom allergies. And so what do you do for an allergy? One is you want to try and prevent your exposure to the antigen or whatever it is you're allergic to. And two, you want to treat the response that you have to the antigen with various medications. You can treat yourself systemically and locally, depending on the extent of your allergic response to the antigen. If we zero right in on the eyes, for folks who have multi-symptom allergic responses where they have a lot of nasal congestion also, those folks generally will do well with something that treats the nasal response as well as the eye response. So they may end up on a nasal spray like a nasal crom and an oral or systemic antihistamine like Claritin, Allegra, or Zyrtec. Those are all over-the-counter ones. Those used to be prescription medications, but now they're localized there. But those, an antihistamine pretty much just treats the immune response once it's already occurred. So to try and prevent the immune response, if you have a lot of systemic problems, you may end up in the allergist's office getting allergy shots, or you can use a mast cell stabilizer like a nasal crom, chromalum sodium, or in your eyes like Lasticaft, Pataday, over-the-counter Zatador. Those are mast cell stabilizers. In kind of combination, some of those medications have a combined antihistamine effect too, so it kind of hits your allergies from both sides. So one is you want to try and prevent exposure to the antigen. When you're outside cutting the grass, if you're an allergic person, put a mask on, wear sunglasses and protective eyewear when you're out there. One, not only just to block the allergens, but also to prevent injury also. And then talk to us if you're if you're having eye symptoms. Talk to your general practitioner if you're having nasal or other systemic issues there.
So if your eyes are the ones that's bothering you, it doesn't necessarily mean that something actually got into your eyes, like grass or whatever. It could be you still just inhaled it, and that's a result of it, correct?
Well, you can inhale it, but if you inhale it, it's pretty much there. You can pretty guess that your eyes have become exposed to it.
Okay.
Also, because your eyes are they're exposed to everything. So it often goes hand in hand there. So we can treat just the eye symptoms, or we can approach it if you're multi-system symptomatic. Then we can approach it more globally by treating some of those other issues and going with a more systemic approach to your treatment. But the eye, there are all kinds of medications that we can use to make you feel better. And sometimes in real severe cases where their allergy is more chronic, we may actually even add a steroid to that treatment also. So it's just very individual, and we have to treat each person individually depending on what their level of symptomatology is.
So if your eyes are itchy or watery or bothering you, it's important also...
Don't suffer. And don't rub them.
Not to rub them.
There's a condition called keratoconus that is and has been linked to rubbing of your eyes. It's a thinning and steepening and warping of your cornea from chronic and prolonged rubbing of your eyes. So don't sit around and don't suffer. There's no reason for anybody to suffer. Come on in and get the care that you need.
So come see Central Kentucky Optometric Associates. They have offices in both Lebanon and Springfield. They can help you with all of your allergies that are going to be coming around possibly this spring. And make sure not to rub your eyes. Get the doctor's work that you need so you can keep them in good shape. Thank you very much.
You're welcome.
All right, this has been Gary White with Dr. Trisconi at Central Kentucky Optometric Associates.